we're going to gang you up in the back. I'm going to try to walk you through. I'll be the main scrub nurse. I had some very main scrub nurses when I learned my surgery. I used to do a lot of, I used to scrub in on open heart surgeries and do my research. And then later on, I actually used to work in the intensive care unit to care people after their surgery. So I would typically scrub in for some trauma surgeries or post-operative heart surgeries, and then I would be able to. So sometimes I would have to reopen the chest to do something until the surgeons could come and stuff like that. So anyway, so we have Dr. Pepper here. He's wearing his Dr. Pepper. So what do you have in your head?
You're on camera. That's a GoPro.
All right. And of course, the person who did most of the work for this workshop is in the back there, in the dean. So we're going to this, and I'm going to stick my finger in and the right atrium, and I'm going to sneak all the way down into the right ventricle. So there's my finger. So the blood comes back through the right atrium, gets squished into the in the right ventricle. So let's grab a pair of scissors. Nurse.
He has a special golden tool.
You can't get good help these days. All right. And let me grab a probe on that too. I'll grab this and this. All right. There we go. So we're going to cut through the atrium into the ventricle. So there we go. There we go. So looking right now in this heart, you can see that this is one of the valves. This is part of one of the valves right there. Look how tender they are. This is kind of rough, okay? And then there's another valve called the aortic valve. See how this aorta is very kind of got a thick wall to it? Let's cut through the aorta. Let's do it. And what you see with the aorta, it's got another one-way valve that's a little bit different. And you can see the leaves of the aortic valve are just these little itty-bitty leaves right here. See these? Yeah? And there's, what's that? That goes to the coronary artery, right there. So here's the little vessel that feeds the heart. So when we go in and do a stent, we go all the way up through your groin, or the aorta, and we find this little hole, and we steer into that hole, and then we use a special camera to actually see where that is, and that's where we inflate. And we follow that little vessel. We can follow that vessel. Well, what the heck? Let's go do it.
How do you find the hole again?
You actually inject a dye, and some of the dye will go down that hole. And then it'll light up the whole vessel. So it looks like a really pretty tree. Now, the trick of this is that the gowns are left like this, and the idea is to go inside the gown and sneak up into, see, this is going to be the inside of the gown so you can handle it. But you don't want to handle the outside of the gown. But you want to go in and sneak your fingers, your hands, into the sleeves and lift it up. Go in there and do that. Sneak into the leaves, there you go. Now inside, open it up. No, let that, oh, you're going to, inside. There you go. All right, now hang on, you can't grab, no, now. You cannot grab it with your hands. You've got to wiggle your way up, wiggle it up, there you go. Do not have your hands come out. No, keep them inside. Keep your hands inside. See, you would have to start all over. And one. All right, there you go. You got it? You got it? Okay. All right. Very good. Now the next trick is your gloves. Now your gloves are packaged in a way that there's a cup here. And so what happens is that the inside of the glove is outside. It's all sterile. So I want you to grab this glove like this, right? And there should be a little thumb there, right? So grab it with your hand, you touch that. Don't ever do that again. Right? Just grab it like this. Okay, now. With your other hand, you can grab the inside. Grab it, and now put it on. Okay, that's good. Stop. Now do the same thing with this one. So there you go. All right, now you just blew it because you're outside,
Okay.
right? But what you would do is that now you wrestle this on because, okay. So what you're doing is actually You're going to grab it like this, right? Right? And then you use the sterile part of this glove. Let me get this open. Right? The sterile part of this glove. And this one has not been bothered, so you sneak it underneath like this. See, that's sterile. Now you sneak it in like this. Now you've got your glove on like that. Now these both are sterile, right? You can now touch your gloves and put them on properly. Okay? Like some people get small heart attacks right there, and it dies. The next thing you know, this valve breaks off and now flows. Great. And they get congestive heart attack. So what we do is we grind out the whole valve, we put in a mechanical one.
And it's as efficient as like as much as it can.
It's very good. We actually use pig valves.
Okay.
We actually take the valves of the pig, we treat it chemically, and we put it in a special mount, and we use them. And with the pig valves, you can anticoagulate. You put them on blood thinners for a couple of years, and then afterwards you take them off, and they're usually fine. Pig valves will last anywhere from 10 to 15 years. There you go, that's right. Yep. The tricuspid valve is the one that gets, when the IV drug users use their drugs, they usually buy chemicals, and the chemicals have been thinned out with either baking powder or sometimes talc. But what we did with that one, we actually perfused the brain backwards. We pushed the blood from the veins into the arteries of the brain because the whole aorta was broken. So we had all the attachments that went to the brain we had to rebuild. Wow. Yeah.
So we're done. So this is a vague mass valve system. This one you connect to oxygen if you need to. But
Yeah, just put it back
this
in
would
there.
normally fit over someone's face quite nicely. So what you would do is you would tilt their chin up. This is the head tilt chin lift. So you would ordinarily put your fingers under their thumb and lift it up. So it's better to not move their neck so much. And then this goes on their face. It's on the valve.
Nothing to do with language or anything. It's what? I can't.
And then someone's doing compressions. But not at the same time, like you would be like 15 and then they would squeeze, otherwise you're gonna like pop their lungs. Well, you probably wouldn't, but
Let's try it.
let's try it. And this is for if you have, someone has things about when they pee, if they have like a burning sensation or if there's an infection. This is like a chemistry on a stick. It's very, you can test the pH, you test to see if there's any bacteria. Do you like the red? It tells you if there's had person. It's not, will not tell you if you're pregnant.
No. I mean, I want to pump it over to 200. Forget about it.
It must be the machine.
Alright, so you guys want to do a drill? Alright,
Me
here's
think
your
so.
your astronauts.
Okay, so here's a kidney. Now this kidney has got about 1 million nephrons, 1 million little filters. And it filters everything except for the red blood cells, the white blood cells, the plasma cells, and a bunch of proteins. Everything else goes into the kidney. And then the nephron decides what to grab back. Okay? And whatever's left over is your urine. So if I've got too much calcium, I don't reabsorb my calcium. If I've got too much sodium, I don't reabsorb my sodium. If I have too much sodium, I get rid of it all, right? And there's hormones, atrial neuritic factor and vitamin D and all these that control, like for calcium. Okay, so let's go in. So the kidney has blood going in and blood coming out, and a little tube to go to the bladder, right? So I'm going to cut into this kidney.
By the way, your watch is exposed.
It's seen worse, trust me. That's not bad. Right? So now let's go in, and now we get the center of the kidney. This is called the calyces. This is where all the urine collects. And you can open this up in kidney stones. And you can see that the kidney is kind of a little bit like the lung. See how all the urine comes out from the nephrons, it gets collected in this space, and actually goes down into this little tube that goes to the bladder. So all these kidneys are dumping urine into this central collecting space. Just grab the skin. Just grab this skin like this.
I'm making it
Okay.
worse.
Is it close? And you do it. Yay! That's too big a bite.
Try looping like what would be to us.
There you go, perfect. That's perfect.
One.
Pull it through.
No, you limit one.
Now try and tie a knot by hand, guys. Don't be doing all instrument ties.
So that's secured, but it,
You want to try? Yeah. Going through the hands of-
You can do it.
Come close to the fork side.
You pass me that?
There we go. Here, here. Put your needle in. Stick it somewhere. I go close to you.
So there's another kind of suture you can do, it's called subcutaneous.
And take it out.
This is where you put the skin together underneath the skin. So you would do something like this, you go underneath
everywhere.
so no one can see your handiwork, it's all hidden underneath the skin.
look, that was this shape.
And then you go on this side, and you do the same thing. And this is how you would try and sew up someone's face. And that way, you don't have all these ugly suture marks. You just come in this way, press this.
There's a knot somewhere.
We do it. You push out, and you take it out. Oh, someone's already tied this off this way.
You want to try it again?
What the heck?